Thursday, March 10th. This evening, we're going to be talking about health awareness. We're going to start with dealing with autoimmune diseases, and we're going to start off from there. We have our co-host this evening. Before we get into that, if any of you out there want to call in, you can do so at 657-383-1155. Also, if you ever want to visit any of our shows via tonight or any previous show, you can do so at www.gftradioshow.com. If you hear me right now, I know you're at Blog Talk Radio .com// GFT Radio Show. And I thank you for that. Please share that link if you would. But we do have our co-hosts online. We have Mr. Jabril, we have Clint, and we have Sonny D. You guys want to say hello to everybody?
What up, everybody? What's going on, people?
Hey, everybody. Good. So we're going to go ahead and jump right into it. As I said, March is certainly a lot of awareness this month when it comes to our health. So we wanted to take the time to dedicate this show to health awareness. And each of us are going to take the time to discuss a few different diseases. If there's something you guys want to add, again, call in 657-383-1155. This show is only an hour and a half long, so we will not cover everything, but we will give you what we can give you in that time. And we're going to start with Jabril. Jabril, what exactly are you going to educate these people on this evening?
Today, Thursday, March 10th, is World Kidney Day. I had to do a little bit of research on this. I did not know this, but apparently this is a very big celebration. I shouldn't say celebration, but it's a big awareness that they're bringing about. World Kidney Day is a global health awareness campaign focusing on the importance of kidneys and reducing the frequency and impact of kidney diseases and its associated health problems in the world. Every March, the second Thursday in the month is when they celebrate it. Originally, back in 2006, they had 66 countries that observed World Kidney Day. Within 2 years, the number rose up to 88. Like I say, today is officially World Kidney Day. A lot of people don't pay attention to this, but Kidney Day, they are. Give me 1 second. I got a whole lot of research written down. If you want to check it out, go to worldkidneyday.org. That's their website that they have out there. I know I'm shouting out these websites and we ain't getting paid for these sponsors and everything. But World Kidney Day, kidney disease, and most importantly, kidney disease in children. You got to act early. Kidney disease affects millions of people worldwide and many children who may be at risk at an early age. So, it's very important and crucial that you get everybody, especially the kids, you got to get them educated. You got to do early detection, things like that. Raise these kids to have healthy lifestyles, healthy lifestyles, and treat them. They can be born with these diseases, or it can be acquired over time. But a lot of people don't really acknowledge the kidneys and how important they are. I'm honestly going to say I slept on the kidneys. Nobody really. You're like, it's just a kidney. Nobody needs that. Like, you think about all these diseases and problems, health issues that people have, and nobody really pays attention to the kidneys. But you have to raise awareness along with everything. There's plenty of diseases that affect people, and kidney disease is definitely one of them. You want to act early and prevent it. That's one thing that everybody out there should be doing. Like I said, if you want to check out any information, go to worldkidneyday.org. World Kidney Day is out there. They're trying to raise awareness for the importance of our kidneys and the overall health. There's events worldwide all over the place. You can go on their website. You can go check it out. You can hit up your local library. Anything that's out there that you can go and check and see if you want to find out any more information. It's all out there. It's just anybody have anything that they want to say about World Kidney Day? Were you guys familiar with World Kidney Day before I started speaking on it?
Well, I actually didn't know. I had any idea that this was World Kidney Day during this month. And like you said, before I never really understood like the function of the kidney. You know what I mean? And I didn't know that, early on that, you really can't, like, kidney disease, there's really no signs or symptoms to it.
Mm-hmm.
You know what I mean? Like, that was a interesting fact to find out. Like, you really can't detect it early. I mean, you can detect it early if you go get tested on it specifically. But if you don't get tested on it specifically when you go to the doctor,
right,
like, there's no signs or symptoms. So that's why it is important. I always tell people, like, go to the doctor. You know what I mean? Because if you don't go to the doctor and get your daily checkups, you really don't know what's going on. And if you kidney, I learned that it usually does not go away. It can be treated. It can be treated, but it doesn't go away. You know what I mean? And the last thing you need to have is, something that you could have prevented early on.
Mm-hmm.
I mean,
well, let me jump in there real quick. Like you say, a lot of people don't know the function, but the kidneys are very important in the removal of waste products from your metabolism. So, without that function, without working kidneys, you hear all these people have like these kidney failures and things like that. It basically means that their kidneys are shutting down and they're not able to remove these waste products. We're talking about urine and things like that. And that's a very important part of your body. I mean, trying to get rid of these toxins and this waste that's in your bodies, and you need your kidneys for that. So, with these kidney diseases and without being able to detect it, you wouldn't know. So, I mean, it's very important that you are aware of what's happening in your body, with your body, and anything that you see or think that is an issue, especially when it comes to the kidneys. This is something that you seriously need to have medically looked at. And that's what they're trying to do. They're trying to raise awareness for days like today. Like I said, I honestly didn't know anything about World Kidney Day, but now that I'm looking more into it, it's something that needs to be looked at and taken seriously. Brad, you got anything?
Yeah. Jabril, if you would, could you kind of walk us into if there are any symptoms, any diagnoses maybe, or any treatments that you have found that they do with kidney disease? I know that the kidneys are a particular organ where, you can live with one of them and you could be fine, but there's always the worry of what if the other one goes bad. And when you think about kidney disease, you don't think of it affecting just one. You think of it affecting both. So what if you lose one? And you'll be fine, but then the other one is still affected. Are there any symptoms that you found, or maybe any treatments? Maybe can you maybe go into depth about that, or maybe people could just be aware of if there's something going on.
Yes. Hold on one second. Like I say, kidney failure. People can live with just one kidney. It is possible. You can survive. They have different kind of treatments, different kind of therapies. You have kidney transplants, things like that, dialysis, or filtration, things like that. You definitely can live with just one kidney. As far as like symptoms or anything like that, it all depends. There's different kind of classifications when it comes to these kidney diseases. One of them are, there's plenty of them out there, but there's, like I said, you can be born with this disease, so doctors can be able to tell you about that early on. What else do you have? No, I'm not looking at WebMD. It's just you have to educate yourself. There's plenty of sites out there. You go to. My wife is disturbing me right now. But hey, talking to her about these kind of things. What were we talking about? The symptoms for kidney disease, right? Hold on.
From what I was reading, there really aren't any early detection for it. There really isn't symptoms for it, or no signs.
Mm-hmm.
You know what I mean? From what I was reading, and what I learned was that between 8 and 10% of the adult population have some form of kidney damage. And like every year, millions die prematurely of complications related to chronic kidney diseases. You know, it attacks your cardiovascular system. I know that much. You know that much. Like it'll attack the cardiovascular system and increase the risk of dying prematurely from cardiovascular disease, regardless of whether they ever develop kidney failure.
Right.
You know what I mean? Like your kidney doesn't have to fail actually for the kidney disease to get you out of here. You know what I mean?
Yes, there's go ahead.
No, I was just about to say that. I mean, it's just that when you know, I mean, the kidney, when complications with the kidney can cause cardiovascular failure, and we all know once you have cardiovascular issues, it's you know, I mean, it's only a matter of time.
Yes, there are some of the symptoms I'm looking up here now. Changes in urination habits, they say, is one of the symptoms. Like I say, I mean, your kidneys are one of the ones that filter out that. So if you have any changes in your urination factors, that could be an issue. They say if it's foamy, bubbly, pale, darker than usual, I mean, that can. Some people might see that and like, oh, you know, I'm not drinking enough water, but no, you know, it might be an underlying issue. That might be part of your issue. Swelling in your hands, ankles, feet, legs, anything like that. Your kidneys start to fail. They're unable to remove extra liquid, so you know you start getting buildup in these parts of your bodies and things like that. These are all issues that people might have and think it's something else and not know that, oh, you know, I'm having an issue with my kidneys right now. If you're having trouble concentrating or you're becoming dizzy, nausea, anything like that, you're getting less blood flow to your brain, and that can be it. You know, foods can taste differently. Kidney disease make things taste different. You have an iron taste in your mouth or anything like that, or you got bad breath. You know, it's not because you didn't brush your teeth; it's because your kidneys are shut down on you. You know, like I say, some of these issues are things that these people don't understand. That they might look at it and think one thing's happening, and it's actually your kidneys that are failing on you. So you know they have to figure these things out instead of trying to become a doctor yourself. Go and get some medical help, some real help.
Exactly. I also was reading that high blood pressure and diabetes are the most common causes of kidney disease. So, you know, like the high pressure causes over a quarter of all cases of kidney failure. And diabetes has been established as the cause of around 1/3 of all cases, and it's the commonest cause of ESRD. ESRD is end-stage renal disease. That's stage 5 of chronic kidney disease. So, you know, like, yeah, it's definitely one of them. And also drugs. Certain drugs, like pain-killing drugs, not, you know, the hardcore drugs, but, you know, people who overdo it on painkillers, you know what I mean, if taken over a long period of time, it can cause kidney failure as well.
Right.
Kidney stones are another thing.
Ibuprofen.
Kidney stones and yes,
like ibuprofen. People be taking too many. I've learned that personally when I was taking ibuprofen. I actually seen it on the TV show. I don't know if y'all Chicago Fire. You know what I mean? That's where I first ever heard it. It was a TV show called Chicago Fire, and the dude had an injury, and he kept taking ibuprofen. He was begging one of his fire department, you know what I mean, one of his fireman friends for some ibuprofen, and the dude was telling him, he's like, man, you keep taking all these ibuprofen, it's going to kill your kidney.
Yeah.
And it was like no longer, 2 weeks after that, I went to the doctor. You know, they did the little blood test or whatever, and they told me, like, I had issues, you know what I mean, like the levels in my kidney was too high, something like that. And I was thinking to myself, like, man, I've been taking a lot of ibuprofen lately for my back, because I was having a back injury. You know what I mean? He was like, yeah, that's the problem. You can't take too many ibuprofens because that'll kill your kidney. I'm thinking that, wow, I heard that on TV. Like, you know what I mean? So
yeah, you know it's crazy too. You know it's crazy too. My son's doctor, or my kid's doctor rather, when they get sick, he tells me not to give them too much pain medicine. Yeah, to kind of let their body work it out, because you can't get them used to the pain medicine, and like you said, that can cause their kidneys to go wrong, especially at a young age.
Yes, a lot of these drugs will have these warnings on. You know, you're sitting and you listen to these commercials about all these drugs and everything that they have out here, these medicines that help one thing, but then they tell you, you know, oh, it can cause all these other side effects and issues. And a lot of the times, 9 times out of 10, these drugs out here affect your kidneys. On the side of some of these bottles, these aspirin, Tylenol, ibuprofen bottles, they will tell you, you know, you can't take a certain more than a certain amount in a day because it'll do damage to your kidneys. It'll do damage to other parts of your body. So a lot of these drugs know this. A lot of these companies know this, and they put these warnings on these bottles for people. But I mean, you have these people out here that'll pop pills all day because you know they're going through pain and not knowing that, hey, you know, you might be curing a headache, but you're killing your kidneys while you're doing it. And like I say, it's all about raising awareness and making these people aware. You know, go out there, get these checkups. You know, any health issue that you're having that you see are changing, and you don't just brush it off. You know, take it seriously and go see a doctor and get it looked at. That's to say the main reason for today, World Kidney Day. You know, that's just what you got to do.
And I think it's important to also alert people to the fact that a lot of things that could attack our kidneys are things that we take every day. Like you guys mentioned, ibuprofen, a Tylenol, and a Aleve. Things that people go, oh, I got a headache, let me take a pill. Oh, I don't feel good, let me take a Tylenol. And that's okay. But when they put those small reminders or indications and everything, those disclaimers on the bottle where it says don't take X amount within a 24-hour period, it's serious. I don't know anybody personally who has taken the over-counter meds to an extent where it has rendered them unconscious or in some severe situation, but it's so possible. So I think, you know, it's important to alert everyone to the fact that things that you take over the counter, just regular things, whether it's Theraflu, Robitussin, Tylenol, Aleve, any of these things that we take just for a quick release, if you take too much of those things and you don't follow the proper instructions or even the instructions that your doctor gives you, it can affect your kidneys. And kidney failure can most certainly lead to dialysis. My father has had diverticulitis, for the last 4 years, and he also has other pain issues. And he has this thing where, for him, ibuprofen works when he has a pain in his back, so he has a ruptured disc. He also has a bum knee, other things going on. But I have to constantly remind him that when you're popping these pills like Skittles, because often it looks like that's what he's doing to me, I'm already, reminding him that not only do you already have a stomach issue, these things can tear up your stomach even worse. So now you're contributing to the issue you already have, in addition to maybe creating something new. And again, these are things you can buy over the counter that are quick fixes. If you take too much, you can tear up your stomach. Exactly. If you feel like, I'm taking these medicines and they're not working, you really need to seek a doctor, because that's a telltale sign that there's something deeper going on and it's not going to fix it. So I just wanted to mention that, because these are everyday medications that you guys are mentioning, and it can very easily turn into something very severe that is unintentional. So I think that was a good choice for you, Jabril, and I certainly thank you for that. Did you guys want to add anything else?
Like I say, one more.
Yeah.
One more thing. Last thing, like I say, any issues that these people are having, don't take anything lightly. We'll get it checked out. You're trying to raise awareness. If you know anybody who's having any issues or anything, help them out. Don't just brush it off to the side. And while you're out there, go to worldkidneyday.org and read up all the information there. That's where everything is. March 10th, remember that, second Thursday of every March. is World Kidney Day. So that's just all I got to say.
All right.
Wonderful.
Okay, and we are. Thank you, Jabril, for that. I think it's absolutely applauded and necessary that we continue to keep our communities aware, because these are things that people don't think about on a daily basis, and it is absolutely our duty to keep them aware. We're also going to discuss epilepsy. I know a few people, including myself, suffer from this disease, but we've given the honor of Sarita, you guys know her as Sunny, to go ahead and educate us on this disease. So, Sunny, if you are ready, we are ready for you.
Okay. Can you guys hear me?
Yep.
Yes. Yes.
Can you guys hear me?
Yes. We hear you.
Okay. I just want to make sure I had my volume down. So I'm sorry. Yes, I'm going to be discussing epilepsy. I chose this one actually because I do suffer from epilepsy. I have a seizure disorder. So I believe this was one of the things that's going on in March. Actually, March 26th is Purple Day, which is a day to recognize epilepsy and educate people who don't know what epilepsy is. It basically, that's the day that they picked out in March for people to have awareness to where they understand what epilepsy is and then know how to take action if they find someone that's having a seizure disorder. Most of the information I'm going to read from you guys, you can kind of go on to epilepsy.com to check it out for yourself and get a little more information. But I got pretty much enough to kind of explain everything there is to know about epilepsy. But epilepsy is a condition of the brain that is characterized by recurring seizures. Approximately 1 in 10 people will experience at least one seizure during their lifetime. A single seizure, however, is not epilepsy. Epilepsy is a condition that is defined by multiple seizures. As I said before, epilepsy is a seizure disorder. It is not a psychological disorder nor a disease, and it's not contagious. The brain is made up of billions of nerves and neutrons and neurons that communicate through electricity and chemical signals. Where there is a sudden excessive electrical discharge that disrupts the normal activity of the nerve and results in a seizure. So basically, it's like a brain issue where your brain is too much going on and it has like an electric signal and then it causes your body to seize. When people think of seizures, they think of the grand mal, which you see people convulse. But there's so many different types of seizures. You can have the one that is called, what is it? It's called basically the grand mal is the one you most commonly see where people are shaking profusely and they can't control them. That's called the grand mal. They have a blank stare, which is the one I have. Well, basically you know what's going on in your surroundings, but your body kind of shuts down and you can't respond. You could also have muscle spasms, uncontrollable movements, and altered awareness and odd sensations. So the location of the brain and of the abnormality discharged nerve cell determines the form of the seizure it will take. So it depends on which side of your brain that the seizure is taking place, where you will have the different types of seizures. Seizures may occur rarely or often as numerous times a day. If the condition is successfully controlled by medication, a person can be seizure-free. I just want to get to the part where it basically tells you what happens, because I know when I used to have seizures, I used to have the ones, like I said, it's the rare form where I would sit there for, it could go anywhere from 15 minutes to a couple hours, or as long as me sleeping through the night having a seizure and waking up 2 days later, and after having while having a seizure during that whole period of time. But basically, what they tell you is if you're ever around somebody who has a seizure, you are to stay calm. The only thing there's nothing really you can do for them, but stay calm. You can time the seizure. If they have more than a row, you got to count them and basically time them. Remove any objects that may cause them harm. You know, some people that convulse, they shake, whether they're standing up and then they fall. You got to clear their path of everything. Don't hold a person down or restrain their movement. You got to let them have the seizure. Don't put anything in a person's mouth. And no, as people most commonly say, let me shove a spoon down someone's throat so they won't swallow their tongue. That is impossible. So please don't, when you see someone having a seizure, especially convulsing, trying to shove something down their mouth, that can cause them more harm than anything else. If the person is having a seizure and they have fluid or saliva coming out of their mouth, the only thing you can do is try to turn that person on their side and make sure that their airway is clear. And basically, like I said, let them have a seizure. Once they come out, you got to wait till they're fully alert to basically question them, because when they come out of when you come out of a seizure, you're not completely all there. You got to kind of like come out. It's almost like coming out of a coma. You got to kind of adjust to what just happened, or your body has to kind of calm down, because it's like an electrical shock to your brain. So your body has to calm down for them to be able to fully alertly respond to you. So if you're talking to them and they don't respond, don't worry. Let them, like, once they fully come out, then they'll talk. But don't offer them anything to drink, and don't offer them food. Let them fully come out. And once they're fully alert, you can offer them water or something to eat. And basically what they say, like, and often you have someone have a seizure, just make sure that they're fully alert and thinking clearly, and call 911. If it was longer than the extended amount of a seizure, which is normally 15 minutes. If it's longer and it's something, and it looks like it's, or if you're scared, you can call 911. 911 will come and make sure the person is okay, but then they'll just leave. It won't be something that they could just do anything to stop the seizure. It just has to happen. And that's pretty much it. Do you guys have any questions?
Well, I just want to go on, just basically picking off some stuff I've learned. If people out there are wondering if epilepsy is inherited, some types of epilepsy have an inherited pattern. Most commonly, these are forms of the generalized epilepsies that begin in childhood or adolescence. Some people have certain inherited diseases, rare in occurrence, that have epilepsy as one feature of the illness. When epilepsy is the sole manifestation of the illness, there is a low probability of inheritance. I got this information. She mentioned it's called Purple Day. I actually got this information from purpleday.org, and which is a good site for people to go to. They got plenty of information on there. They let you know how epilepsy treated. You have anti-epileptic drugs are the principal therapy for treat epilepsy. These drugs do not cure epilepsy, but attempt to control it by suppressing seizures. The ultimate goal of the anti-epileptic drug therapy is to establish perfect seizure control and minimal or no side effects from medication. Sometimes long-term seizures control may not be possible because of the underlying cause. So basically, if you have a certain type of disease that epileptic seizures are a byproduct of, that sometimes the control, you can't control it because the disease is what actually is causing the epileptic seizures or what have you.
Mm-hmm. And I just want to chime in real quick. I've had seizures since I was a baby. I started out with the convulsions, and then as I grew older, I started having the blank stare one. Just as recently as not last year, but the year before, I actually had a grand mal seizure in my house, and as like me being a person that has seizures, I forget sometimes I have to make people aware of what I like my disorder, even though I don't have it as often as I used to. I can still have one at any given time, and I kind of like after I had that seizure, I kind of felt bad because thankfully my daughter was here with along with my son. And my daughter acted. She called my sister, and then she called 911. Like, you have to educate people of what's going on with you, because if they don't know, like when something like that happens, they don't know what to do. And then they go into a panic mode. But if you educate them ahead of time, they're aware and they know what steps to do.
I agree with it because I know quite a few people that, suffer from epilepsy, and they don't want to alert other people that they're around because, one, they don't want people in their business. Two, they don't want people to think that they're crazy. And they don't want to startle anybody. So I think that when we're taking the time to alert people as to what epilepsy is it will also educate the people who don't suffer from these seizures, and can then make someone who is suffering from them more comfortable with just saying, hey, if I ever do X, Y, Z, here's why, here's what to do. And I would be uncomfortable if someone just fell out and had a seizure and I didn't know. So a lot of times, I get that people don't want to say what's going on with them, but if there's someone who you are always around, you have to be able to trust somebody with that, because it could literally be a situation between life and death. If you fall, hit your head, if you're by yourself, or if someone is in the house that can help you, more importantly, that can maybe turn you on your side. I have heard of 2 people that have had seizures, and they've swallowed their tongue, literally, because they've had the seizure and things that, your tongue falls back in the back of your throat. And it's not to scare anybody, but it was just the awareness of it all and just being realistic about it. If you suffer from those seizures, it is definitely, Sarita, I agree, imperative that you involve someone and that you alert them to what is going on, not to scare them, but to alert them just in case, because you could be fine.
Yes, because what's funny, too? So you know what's funny too? I had them in middle school, and then when I got to high school, I started having them every day for long extended amount of time. Wow. And I remember my doctor saying, well, Sharita, you have to go to school and tell your teachers. I'm like, well, I don't want to go to school and tell my teachers, but I had to, and I'm going into all 8 periods saying, hey, in the first class I walked into, I put the teacher aside and I said, listen, I need to explain something to you, and let me make you aware of what's going on. So I made him aware. I walked into class. He had the conversation with the class. I sat down and had a seizure. I was like, this is just great. Like, this is just, and like I said, it's hard for someone to tell you that, because, like I said, to me it was embarrassing, because at one point I got people calling me the girl that dies in class, and you're like, oh, watch out for her, she dies in class. I'm like, no, wait a minute, because because people don't know, they're not educated, they don't know what it is, so they say things, and I had the ones where I could just, I can tell you everything that happened while I was having it, but I just couldn't respond. I couldn't move, couldn't do anything, but I can tell you everything that happened, and I can tell you, oh, well, you laughed at me, you said this, that, and the third, and it was, but like I say, you have to make people aware, because if you have it, and like I said, and like you said, if you're out with friends one day, you go out to a night out, and then all of a sudden you have a seizure, and nobody knows you have a seizure, they're going to be freaking out.
Right.
Especially if they never told one. And mind you, I have seizures. I remember going to class one day and some boy I know had a seizure. He shook. I cried. And I was like, why do you cry? You have seizures too. I haven't seen anyone shake. I seen my brother back when I was a kid, but not in high school. Like, I saw somebody completely fall out their chair and seize, and I'm looking like I'm freaking out, and I have them. So, whether you have them or you don't have them, it's a scary thing to see, and to understand what it is and to be able to act and help someone, that's the best thing you can do for anyone.
Did you guys have any experiences you wanted to add, Clint or Jabril, before we moved on?
Not personally, but I mean, I've always looked at things like, I used to watch a lot of shows, House, ER, things like that, and they talk about the people having seizures, and like Clint and Red both said, there's signs, there's symptoms. The actual cause is unknown, but these people are out here. It can be a brain injury. These people have football players. A lot of them having concussions and things like that, and they can have concussions. Like Clint said, you have to find out what the underlying effect of it is. The concussion isn't what is the main reason of the seizure. You have to find out what the underlying effect of why the person had the seizure, and it could be plenty of reasons. Like I said, the exact cause of epilepsy isn't known, but if you have these kind of injuries, you could be susceptible to having a seizure, and it doesn't necessarily mean that you have epilepsy. It could be something else that causes a seizure. So, this whole radio show tonight is all about awareness. So, you're raising awareness to figure out these issues.
Right.
And that's what
it's all
about. Say that again.
Sorry?
I said they never told me why I had them, and like when you have seizures, it's a neurological disorder. It can also affect your development. That's why it's also linked to autism and things of that nature, because it's a neurological thing that can stop your development. Because I remember them asking my mom to put me in sexual ed because they didn't know if I was going to be the developmentally there along with my peers. But I was able to, like, not only was I able to, I actually was a great student. I just had that one issue. Other than behavioral problems, but, you know.
Actually, when obviously I wasn't born, but I was told my father, when he was, you know, he was like 3 or 4, like my grandma used to send him to the store. You know, that's how smart he was. He used to send him to the store with money and cash. He'd come back with correct change and all that. And then he had an accident. He fell. He had some type of accident, and he started having seizures.
Yeah.
After that, he started having seizures. Like, he was never, when he got older, he was never, like, his intelligence and everything was, you know, I mean, he was still on point. He was still sharp. But it was sort of a difference after he had that head injury, and he used to catch seizures, you know, I mean, when he was younger. As he got older, you know, I mean, he really didn't catch any seizures, but when he was younger, he used to catch them repeatedly. You know what I mean? So, like, falling, hitting your head or something like that, you know, I mean, like, piggybacking off what Jabril said when he brought up football and concussions and stuff like that, that was a perfect example, because that type of stuff can cause seizures, and you have all type of neurological
stress can cause seizures too.
Yeah.
If you're stressed out, it can cause you a seizure. One of my friends was pregnant, and she was in the process of pushing her son out, and the stress on her body had her going to a full grand mal seizure, trying to push her baby out, and they had to pull her baby out of her. So, like, it can happen. Like, you could not have seizures ever, and randomly, like I said, it can happen to you at least once in your lifetime. So even if you're not suffering from epilepsy, you can have a seizure. So
right,
just be aware.
Mm-hmm.
And it's not something like, even when you have seizures, you can't really tell it's coming on. There's no sign that it's going to happen to you. They have some dogs that can sniff a seizure out, but I can tell you, as many seizures I had, I never knew none of them was coming. It just happened.
Yeah, they say that about what's that, like the flashing lights and things like that. You know, they have these rides and attractions and shows. You go to these theme parks and they tell people, you know, if you have seizures and things like that, you can't get on this ride because, you know, there's flashing lights and strobe lights and things like that.
It could cause, like, when you go to neurologists after you have seizures, they do like a light therapy thing on you. And I remember the recent one I had, they did that, and I, like, you know, the first couple lights, like, it's different light patterns they do, just to see how your brain, because they're monitoring your brain. So while they're doing this light thing, they got you laying down, and your brain is hooked up to the EKGs, the EEGs, and they're doing like a series of light thingies on you just to see, like, you know, how your brain responds. And I can tell you, like, I don't know, like, towards the last light thing, I couldn't tell you what happened. Like, I just went, like, it just went. And she was like, and then she had to, like, kind of calm me down, because after the last seizure, the recent seizure I had, and then the one I had in the office, I, like, went into a full-blown panic attack, because and I think I went into a panic attack because I couldn't believe that happened. I haven't had a seizure since I was in 11th grade. I'm now 32. So for me to have a seizure at 31, I was like, whoa, wait a minute. I ain't thinking anything quite a while.
Actually, I was mistaken. My previous job, I used to work at the Trenton Public Library, and there was this young lady that worked there. And until Jabril just brought up the lights, I totally forgot. Like, when the lights, like, sometimes, you know, like how a light blink, like when it's about to die and it's blinking real fast. And one day, we're working, and she was working by that light, and that light started blinking. And I guess she looked at it, and she had one of those, like, she broke down right there, and she had a seizure right there. And, you know, one of our coworkers who was a good friend of hers had to take her home or take her to the hospital or whatever. You know what I mean? So, like, until he brought up the part about the lights, I forgot all about that. You know what I mean? So, like, I actually did see somebody have a seizure in front of me from, you know what I mean, that, and she actually cost her job because she used to catch so many seizures at work because of the lights.
But she could have She could have got
she
could have sued them for that.
Because the doctor would never whatever doctor she had, I guess wouldn't give her the proper paperwork to officially diagnose it or whatever. So there was an issue with that. They definitely people at the job was trying to fight for her. But Red, you want to chime in?
No, I mean I think it's just I have an aunt that has epilepsy, and the crazy thing about her situation is she, along with two other people that I knew, because they hadn't had seizures in a long time, they stopped taking their medication. And a lot of times people are taking this medicine, and because they're okay for a long time, they think, oh, I'm good, and they become their own doctor, and they stop taking the medicine. Whether it becomes too expensive, whether it becomes, I'm good, I haven't had an issue, whatever the reason is, because I've heard several different reasons for them stopping their medication. The fact of the matter is that you can't diagnose yourself in a situation like that. And when it comes to that, no, it's not like if you're taking medicine for 6 years and you not take it one night, boom, you're going to have a seizure. I'm not suggesting that would happen. It may not. But the fact of the matter is that it's a disease that you can't just up and stop taking your medicine for it. And it's absolutely imperative, because sometimes if you have a seizure, like I said, you could be anywhere. If you're out somewhere and you can have a seizure by yourself, and you decided to stop taking that medicine, and then who's going to catch you? Those seizures could lead to other injuries. It could be a lot more serious than it is. But definitely, Sarita, you engaging us and talking about epilepsy and also grand mal seizures, which is two different things, but one and the same. One is most definitely more severe than the other, and it does depend on the person. Everybody is different. But it is absolutely imperative that we are aware of it. If you know somebody with it, make them feel comfortable. If you have it, make sure people around you know about it, and that you are taking care of yourself. And it's okay to have it. It doesn't mean something's wrong with you or that you're less than. We just want to make sure that if you are around someone, that they are aware and that you're safe. And that is what we're trying to have here on the show. Did you want to add something, Sarita, or did you want to?
No, I'm just, like I said, you can go to epilepsy.com and check out more information. And any more information you want to know about seizures or epilepsy.
Absolutely. Thank you so much. The next subject that we're going to talk about is very near and dear to our co-host, Clint. I'm going to allow him to educate you guys on this disease, and then we'll kind of go around the table with it. I think a few of us have also had a personal occurrence with this. But if you will, Clint, talk to us about sarcoidosis, what it is, what the diagnosis is for that, maybe if people are aware of it, and what has been your experience with it?
Okay. Now, I am actually diagnosed with sarcoidosis. That's a disease I'm dealing with. My father was also diagnosed with it. Let me explain to you what sarcoidosis is. I'm going to read to y'all the definitions and the symptoms from off WebMD.com, and then I'm going to run into my own little personal experience and explain it from there. Sarcoidosis is an inflammatory disease that affects multiple organs in the body, but mostly the lungs and lymph glands. In people with sarcoidosis, abnormal masses or nodules consisting of inflamed tissues form in certain organs of the body. These granulomas may alter the normal structure and possibly the function of the affected organ or organs. What are the symptoms of sarcoidosis? Tender reddish bumps or patches on the skin, red and teary eyes or blurred vision, swollen and painful joints, enlarged and tender lymph glands in the neck, armpits, and groin, enlarged lymph glands in the chest and around the lungs, hoarse voice, pain in hands, feet, or other bony areas due to the formation of cysts in the bones, kidney stone formations, we talked about the kidney earlier, enlarged liver, which is, I'm going to get into that, something I had to deal with, development of abnormal or missed heartbeats, inflammation of the covering of the heart, or heart failure. Nervous system, it affects including hearing loss, meningitis, seizures, or psychiatric disorders, for example, dementia and depression or psychosis. So those are the symptoms. I'm gonna tell y'all real quick what happened to me. Back in January 2014, the first week, I had got sick. This is the last time I ever felt personally, right before I got sick, personally, last time I ever felt like me, real good. I had car trouble. You know, I was walking from all across town to get my car fixed. And it was drizzling, it was raining, and I got sick the next day. So eventually I ended up going to the hospital, and they diagnosed me with pneumonia. They did the x-ray on my chest and everything. My lungs and all that stuff was good, but they said I was diagnosed with pneumonia. And, you know, from what everybody told me, like pneumonia, even when you get the antibiotics that I got, it is still linger for a long time. You know, so come March, mind you, like I said, I caught pneumonia in January. Come March, I was still sick. Like, I was still feeling effects from it. And I couldn't really, you know, me and my girl at the time, we shared the car, so sometimes I would walk home at night because my job was only like 10 minutes from my house. And, you know, like 5 minutes into the walk, I couldn't go any further. Like, I had to stop and, like, sit down. You know what I mean? It was crucial. So, you know, in my mind, I thought it was just, okay, these are the residual effects from the pneumonia. So eventually I started losing weight. I couldn't hold down any food. You know, when I first got sick, I was 220. By the time I eventually went to the hospital in June 2014, I was down to 170. And when we was in the hospital, they did the tests and all over, tested my lungs. I thought it was my stomach. You know what I mean? The reason why I'm telling you this story, because when I went to the hospital for my stomach, they did all these x-rays and stuff, and they was like, you're fine. They didn't understand what was wrong with me. So the first doctor, she was about to send me home. The next doctor came in and compared my lung x-rays in June to my lung x-rays in January. And I had massive amount of scar tissue. And, like, she was scared. She was like, you know, I've known people who smoked cigarettes for over 50 years, never had this much damage on scar tissue on their lungs. And I couldn't, I'm like, you know, and me and my girl was there at the time. She explained to her that how my dad had it, sarcoidosis or whatever. So they had to do a biopsy because they didn't know what I had. They thought I had TB. They thought I had AIDS. You know what I mean? I actually isolated. Yeah, I isolated in a wing in the hospital by myself. People had to come in wearing masks. No, it was a whole big ordeal. I was in a hospital for a little over a week. You know, but when they found out I had sarcoidosis, you know, they tell you, like, they really have no information on it. Like, they don't know where it comes from. They don't really know how to treat it. All they give me is prednisone, which is a steroid to combat sarcoidosis to make it go into recession. But it really you can't stay on prednisone or steroids for too long. So I got healthy again. What I thought I did, and, you know, come 2015, last year, it was worse. So it went from sarcoidosis to it only lasts from 3 months to a couple years and go away to now I have progressive sarcoidosis, which, you know what I mean, only like 5% of the people who get sarcoidosis have this. And I guess I'm the lucky 5 of that 5%. So it attacked my lungs again. So now my lungs, imagine all y'all are healthy with healthy lungs. Imagine your lungs shriveled up to half the size, plus with the scar tissue. So that's what I'm dealing with. Plus it attacked my liver. So I had to get on some type of, it was medication. It was almost like being on chemotherapy. And, you know, to this day, I'm still on it. So, you know, it makes my heart work harder than what it has to. So there, you know, I had to go see a cardiologist, had to get, you know, EKGs and all that stuff done on my heart to make sure there was no damage to my heart. Every year I had to get an eye exam because it can go to the eye. It affects your vision. It can attack the brain. You know, if it goes unchecked, sarcoidosis can kill you. You know what I mean? It could cause many more different issues. You know, it's mainly like a cardiovascular disease. I went from being able to, walk from work, like I said, a 10-minute walk. At best, speed walking, I can get there in like 6.5 to 7 minutes. To now, it's like I can't even walk down the block without getting winded.
Right.
You know, so it deteriorates quickly. It deteriorates your going unchecked. And that's why I always employ all my friends, especially black men, to go to the doctor, because I waited. You know, maybe I could have, like I said, I started feeling the effects in March of 2014. And I didn't eventually go to the hospital, forget the doctor. I didn't go to the hospital until June. So it was like a 3-month span where I was just, you know, losing weight, throwing up, going through all these issues. I was trying to fight it. I was trying to fight it on my own accord, and it didn't work. So I implore everybody, if you have issues like this, to go to the doctor, get treatment, you know what I mean, see what's wrong with you, so you can face it earlier, so it won't deteriorate so quickly. You know what I mean? So that was my thing I wanted to do on sarcoidosis. You know, it's a disease that many people, mainly young black women, get affected with as well, more than men. But it's mainly, you know, it's a disease that's becoming more prevalent. So that's all. That's what I want.
Isn't that what Bernie Mac died from? Or not died from? He died. He had pneumonia or something. But didn't he have sarcoidosis also?
Yes.
I'm not sure.
Yes.
I'm not sure. I know for a fact Gerald Levert died from sarcoidosis at 42.
And Bernie Mac too.
Same age as.
Yes.
And Bernie Mac too.
Also,
okay.
yes, he did. Okay.
Yep, I know, because Gerald Levert, at the same age as my father, like I said, my father died at 42. Gerald Levert died at like the same age, and they both died from complications from sarcoidosis.
Absolutely. I definitely want to thank you guys for that. Just as a reminder to those of you that are listening in, usually our after show runs until 11 o'clock. We're definitely going to go over this week because we want to keep you guys in the know. If you guys want to call in, you can call in at 657-383-1155. We'll be here on air until 11:30, going on with our health awareness. So don't worry about the time. We're here to listen to you. Clint, I appreciate that. I definitely thank you for opening up to us and being able to alert the callers to what you're dealing with personally. I think those things are relatable. And a lot of times people, like I said, I know for me personally.
I think we have a caller.
We actually do. Hold on 1 second. You're good, Clint. I like it. Hold on 1 second. How you doing, caller? We are live on the line. What's your name? Hello?
Bitch, what's the... Call me, yo, hello?
Yes.
Yo,
you're live on the air. Yes.
Oh, me? A nigga like me?
Yeah, Bree. That's what's up.
Yo, hey, Clint was good. Hey, Clint, son, listen to me, son. I ain't even know you was sick like that. You hear me? You know what I'm saying?
Yeah.
Listen, you a strong dude. Man. You gonna be alright. You hear me? Listen.
No doubt, bro.
You know you gonna be like fucking strong. Like I'm listening to the podcast. I want to bang right now. Who you doctors out here in these streets? You hear me? Like, yo. Hey, Ginger Fudges, how you doing?
How are you, bro? How are you?
Cardi Bree. Watch me, ratchet. Yo, what y'all talking about out here in these streets? You was breaking my heart on these airwaves. I ain't even call in. I was listening. I just doing on the radio. Who is y'all? I love everybody, though. Yo, listen. Hey, Clint. Let me listen right now.
Yeah.
Y'all can hear me? Listen to Donald Trump.
Yes, sir.
Listen to Donald Trump. Listen. Don't write him off as a kook just yet. Donald Trump is a racist, a bigot, and all that. He's not lying about the numbers, though. Check the numbers. Yeah. Everybody robbing.
Thank you.
Y'all can hear me?
Thanks for calling in, though, Bree. Appreciate that.
It's a slave society. It's a
Right.
society
Yes,
based off of perpetual debt. So you get a nice car, they charge you. You get a not so nice car, they still charge your ass. Right? They don't give a fuck about none of that. You pay your insurance, you don't get into an accident, they don't give you your money back. You owe them anyway. Like, yo, listen, they are robbing. Hey, listen, you can hear me out there in the radio waves? Hillary Clinton, anti-Christ. She the anti-Christ. Google her.
Oh, man.
Hillary
Thank you so much for
Clinton.
calling in, Bree. I appreciate that. You should definitely always looking out. We appreciate that.
Listen to me.
Yeah.
Bernie Sanders with Elizabeth Warren on the ticket. Elizabeth Warren is the strongest person we have, period, male, female. It don't even matter. Listen, that shit never matter, my nigga. Like, I was.
And before we move on into the next show, definitely, Rihanna, thank you for calling out. That was awesome. I think we lost some on the call there. No worries. We'll definitely keep it moving. Again, Clint, thank you so much for being able to offer us that time to kind of delve into your personal life. I know for me personally, I have a family member that has sarcoidosis of the lungs. My mother personally has sarcoidosis of the eye. Sarcoidosis can actually attack you either in your lungs, in your eyes, in your heart, or in your brain. And although they have no idea where it comes from, it's not as bad as it sounds. I guess just from having the experience with it, but it is huge. If you do not get properly diagnosed with it and you do not properly receive the treatment that you need for it, it can be fatal. As we've heard from Jabril and myself, I think it was Gerald Levert that they mentioned, and also Bernie Mac. Bernie Mac did pass away, I'm absolutely sure, from this disease, and it can be fatal. So we say that to say, people, if you do nothing else but make sure that you are keeping up with your health, keep up with it. I think for me personally, the hardest people to check themselves is men. Yes. They can be extremely stubborn. They will be near death before they go to a doctor. I know in my family, and I'm not speaking for everyone, but we certainly all across the board need to make sure that we're doing that. Again, Clint, I thank you for that, for opening up to us. The reason why we decided to go in that order, our next disease that we're going to discuss hits home for me. It is MS awareness. Although Sarcoidosis Awareness Month is April, and the Sarcoidosis Awareness Day is April 11th, we wanted to kind of get you guys up to speed on that. But MS awareness for us is a huge deal here on this show, especially for me. Not many people know, but recently my mother was diagnosed with MS. And because my mother also had sarcoidosis, we didn't know what it was. And I think it was important for us to cover both in the order that we did, because in my area, in my experience, we didn't know what my mother had as far as what was going on with her brain activity, if it was sarcoidosis of the brain or if it was MS, because brain diseases are very hard to diagnose. It could be a number of things of that nature in different doctors before they narrow down what exactly is going on. When it comes to sarcoidosis of the eyes, and I'm going to just tell you from my own personal experience, I'm not going to get anything to you. Sarcoidosis is actually the inflammation behind the eyes. And what happens with that is it could cause you to have a lot of tears. It looks like you're crying sometimes. And what it is those ducts behind your eyes, they're draining. For my mother, she has had to have a number of different operations and procedures on her eyes. And she's actually had stents put in her eyes that will drain that fluid, because that fluid behind your eyes, when the pressure builds up, it can cause you to go blind. And if you don't have those things checked and you have vision problems, it could be sarcoidosis, it could be glaucoma, it could be a lot of things. But in this situation, we are discussing sarcoidosis and MS. So again, with my mother, it was hard to diagnose her because she already had sarcoidosis. And, of course, if you can imagine, if you already have sarcoidosis in your eyes, having sarcoidosis of the brain isn't far-fetched because it's right next to it. My mother was diagnosed with MS April of 2015. And before I go any further with that, what I would do is first discuss with you guys what MS is, and I'm going to use the definition from the National MS Society. MS is an unpredictable, often disabling disease of the central nervous system that disrupts the flow of information within the brain, as well as between the brain and the body. In multiple sclerosis, damage to the myelin in the central nervous system and also to the nerve fibers themselves interfere with the transmission of nerve signals between the brain and the spinal cord and other parts of the body. In layman's terms, what that means is that when you have MS, the nerve endings that are in your brain, as we all know, your brain communicates with the rest of your body. When you have MS, the nerve endings in your brain don't communicate properly. That causes other things to malfunction, and you're just all completely discombobulated. And that is what happens with the disease of MS. The cause of MS is still to this day very much unknown. The progress, severity, any particular symptoms of MS, if any one person it's yet predictable. It changes in every single person. Most people with MS are diagnosed between the age of 20 to 50. I say most because there are some people who are diagnosed after that. I don't want you to think that's the end-all, be-all, but most are diagnosed between the ages of 20 and 50. And with at least maybe 2 to 3 of those people, there's 2 to 3 times more women than men that are diagnosed with MS. When we talk about symptoms, a lot of symptoms, all of them overwhelming. It could be fatigue. It could be visual disturbances. It could be altered sensations, maybe difficulties in mobility. Again, speaking from experience, when we noticed something was awry with my mother, she began to, one day I was in her living room, and as she got up to walk from the living room to the kitchen, what she did was she walked from the living room into the kitchen, but she began to walk on an angle. She didn't realize she was walking that way. And I mean, she literally got up from the sofa, and as she would walk a straight line into the kitchen, she went almost on a 40-degree angle and then came back because the opening was another 10 degrees to the right, if that makes any sense. She didn't realize what she was doing. To her, she was walking straight. To us, we could clearly see she was walking on an angle. And it was then that we went, what's going on? One day, she happened to get ready for work, and she completely lost her balance. And with that, we knew something was wrong. She went into work, and if you guys out there that knows, my mother knows she's a very proud woman. She went into work. My mother works in the hospital, and she went anyway. Well, what happened was she passed out. And that was when they knew something was wrong. So most certainly any difficulties with mobility, like I said, any sensations, any visual disturbances, those things are symptoms of MS, so you should definitely get checked out. Majority of people with MS, I think our biggest concern has been times we see people with MS who become immobile. They're in wheelchairs, they can't do anything for themselves, and it's something for us as for children to think about. But majority of people with MS actually don't become severely disabled. I just learned that literally in the last few months. I had no idea. I just know what I saw. It is currently incurable. However, there has been a lot of medications, including the ones that my mom is taking, that have shown to modify the course of MS by reducing the number of relapses that they have or any delayed progression of disability to some degree. Like I said earlier, diagnosing MS can be challenging. We're not suggesting any of these symptoms that we're mentioning here on this call today that automatically mean that you have MS. It is simply a disclaimer to get yourself checked out. Early MS symptoms can be nonspecific, and they could be suggestive of any of other several disorders of the nervous system. Early symptoms can come and go, be ignored. They can be severe. No single laboratory test is yet prove or rule out what MS is. However, there are some things, especially when you're getting MRIs, where they can kind of narrow down what it is or what it is not. For those of you that may have these symptoms and may even want some more information on what MS is and what how you can deal with people who have it. Not just if you maybe are experiencing these symptoms, but maybe if you know someone who has it and you want to know how to help them. This is the National MS Society. Their website is www.nationalmssociety.org. There is a ton of information there on their website. I also want to take a few moments to just mention that here in the Trenton area, we're actually going to be doing a MS Walk. These guys here on the call, my co-hosts, don't know it yet, but on Sunday, April 17th of 2016, there's an MS Walk in Veterans Park, and everybody on this call, all of our co-hosts, Sonny D, Jabril Roberson, as well as his wife and his children, Clint and his daughter, and anyone else he wants to bring along, we're all going to be participating in the MS Walk because the people on this call are very serious about health awareness. We don't do this just to talk about it as a show. We've done a number of shows, and I applaud you guys for being very serious about this. We're just educating our communities. I think when it comes to the black communities, a lot of times we are not doing that well enough, and we're not doing it enough. So I applaud you guys for being serious about that. But we'll be there. The host of GFT Radio Show will be at the MS Awareness Walk. We're going to find a sarcoidosis walk as well. Any other walks that are in your area, get involved. It doesn't matter if you're donating, if you know someone, if you don't wait until it's too late to all of a sudden be serious about your health. I don't know if you guys want to add anything else about this call, but I definitely want to thank you all for tuning in, for one, before we go into the after show. But also, I think if you could take something from this call, from our kidney disease, from Mr. Jabril, Clint being very personal about sarcoidosis, and Teresa as well being personal about epilepsy, be serious about your health. Get checked out. We're all getting older. These guys are all older than I am, but the thing is, they're serious about their health. You should be too. You guys want to add anything before we go over?
I just want to say, like I said, I mean, this show was all about awareness. Like everybody said, I mean, these conditions are out here, and, they have underlying effects. You might think it's something simple, but, just go out there and get yourself checked out, raise awareness. These are issues that are in our community, and we can't just keep bypassing them and acting like they're not issues and not affecting people. I mean, like I said, I have co-hosts that are affected by what we talked about. Family members, friends, just stop ignoring these things and actually take a stand. Well, not really take a stand, but take some initiative to educate yourself and others when it comes to things like this, and just go out there and get some things done. That's all I got to say.
I want to add that. I just want to add real quick that, a lot of times, like with mines, like I said, when I initially went to the hospital, I went for a whole nother reason, like for my stomach. And that's how I found out about my chest. Secondary, about my lungs and everything, secondary. So that's why I implore everybody, please, like piggyback off what Jabril said, take some initiative, go get yourself checked out, because you never know what's going on. It may seem like something simple, and it could be totally something else, and you want to catch it before it gets out of hand. That's all.
Right. Teresa, did you want to add anything before we went into our good after show?
Well, no, I just want to let everybody know that just pay attention to your body. No matter what nobody tells you, no matter what doctors you see, pay attention to your body. You know when something's wrong with you. You know what you need to do. And if someone tells you no, or they don't know what's going on with you, go back and go see someone to get a second opinion. Go find out what it is that's going on with you, so you know your body.
That's right.
Definitely.
That's right. And again, I just want to thank everybody for tuning in to the show tonight. Don't worry, we're not going anywhere. We're actually going to open up our after show as we do each and every week. And we're just going to chit-chat a little bit. So we guys want to hang around, great. We're just going to top it up, and we're going to talk about the show. We're going to talk about what you're going to talk about. Most importantly, we're going to talk about voting. Some of you guys are not registered. I saw the numbers. Okay, I'm lying. I didn't see the numbers, but I know some of y'all didn't register. I know y'all playing around with it, and we want to make sure you guys are serious about it. So don't go anywhere. Join us. We're not going to go into the after show. I don't know, guys. I mean, what did you think of the show? Anything you wanted to add lastly? Current events? What you guys want to talk about? Bro.
I enjoyed this show. Like I said, I mean, this whole show was all about awareness. I love when we do shows like this. You know, you're opening up to things that people didn't know about, educating us on things we didn't know about, or, you know, we may have known about it but didn't want to talk about it. But these are things that need to be talked about, need to be educated, and I enjoy when we do shows like this.
Right.
Yeah, me too. No, I mean, I like, you know, I like to share information, and I like to receive information. And I think tonight we did a perfect job at both. Now, yeah. Sharing information and receiving information, you know what I mean? And hopefully I know the listeners out there, you know, I mean, like we said, this is awareness, so we want them to become more aware of their health, you know what I mean, especially in our community, because, you know, people don't take it serious enough to me. You know what I mean? I think people feel like, you know, we're superhuman. Right. You know what I mean? It ain't gonna happen to me. You know, I'll be all right. But nah, it doesn't work like that. Work like that. These diseases have no name. They have no name. They will attack you, anybody at any time.
That's right. And shout out to you guys, because I think that the fact that Jabril is always honest about the fact, or even Clint, I mean, just all of us. I think it's important that our listeners understand that the things that we talk about on this show are not things that we already have prior knowledge of. Sometimes we have to do our research. So we're not doing things that we already know about. We're doing things that is extremely important that we discuss. And then sometimes we have to go back and read ourselves because we haven't the slightest idea what it is, but we know it's important. And I think Jabril, I wanted to point that out because I think if there's anyone mostly of the co-host, we've all pointed it out, but I think you pointed it out the most, and it hits home because people need to know that these aren't things that we know about initially when we're talking. We're literally oftentimes researching before we have a show to find out what is that. Yeah. We don't even know what it is. So definitely shout out to you guys for always acknowledging that on air. People need to know that we're not always in the know.
Yes, and also to piggyback off you said too, like even if we have personal knowledge of the things that we're going to talk about, we don't know everything about it. So we have to still research and educate ourselves more, because I know what my disease, I never really looked at it and understood what it was. This gave me the time to actually understand what it is, well, not a disease, disorder, but to understand what it is. And now that I'm dealing with another kind of issue related to this, related to epilepsy, it's kind of opening my eyes to kind of see how the two are entangled and understand it better for what I'm currently dealing with my I kind of just want to briefly tell you guys, like, I'm dealing with my son. He just got diagnosed with autism, and I'm reading up on it. And as I'm reading up on autism, educating myself to how to deal with him, how to learn what this issue is, and just to better my knowledge of it and be able to help my son. But in that autism, they do have epilepsy, so it kind of conjoins the two, and it makes me curious to know how does it relate to each other. I mean, and educate myself more. So we, like I said, as we're doing these shows, we're educating ourselves and we're educating each other, because I didn't know what all Clinton was going through. I didn't know what Kenya Moms was going through. I didn't know what kidney disease was. I knew what my issue was, but I didn't really know what theirs was. So now they're educating me to understand things that I never even had a conversation about. So, I think like you said, we're educating ourselves and we're educating each other, as well as educating the people that are listening to our show. Yeah.
Mhm. Yeah.
Absolutely.
I also want to point out, like, we're all, we're talking about diseases. We're all talking about, personal experience or anything like that. We also have to take into account reason why don't just stay, number one priority is yourself. So you want to stay on top of your health because for you, first and foremost. Mm-hmm. But you got to understand also how being sick and being ill affects the people who love you and the people, that support you. It's stressful for them as well. So you want to stay on top of things that alleviate that stress. I seen my father, when he was going through his decline, and I seen how his wife stuck by him, handled her business and supported him all the way through. But it was stressful. It was stressful, not just for him, but for everybody. And I know with me now, I have a daughter. I think about her more so than me. Like I gotta do what I have to do, not just for me, but for her, because me not being healthy doesn't just affect me; it affects her because she depends on me. So if you got kids out there that's depending on you, or you just have family members that's depending on you, or a wife or a girlfriend on you,
right?
I ain't talking about this for money, but for just for you being there. Yeah, right. You owe it to them, not just yourself, to stay on top of your game.
Praise the Lord. I'm so glad you mentioned that because, for people out there that don't know who I am as in relation to who Clint is, Clint and I are very, 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 very good friends. And we've been very good friends for a long time. However, outside of this show, even with dealing with the things that Clint goes through, I'm so glad that he mentioned when you have people who care for you, that you were thinking about yourself, because like men, they're hard-headed, they're stubborn, they don't listen. Clint is one of them. And I only say this not to get on him, but because I want you guys to know that when it comes to this show, we are 100% realist. We are very much want you guys to know that we are relatable. These are things that we deal with all the time. I am always on Clint about his health and making sure he is good. So I'm glad you pointed that out, and you are absolutely right. A lot of times people do not consider those who care about them and that they just want to make sure that they're good. Sometimes it's extremely hard when you're dealing with it to go through what you're going through and also remember the other people that it affects. So give consideration to people who are going through things, even if it affects you, because it's two totally different things. So you still have to have compassion for that. So shout out to you, Clint, for mentioning that, because I don't know if you ever get it because you're super hard-headed, but I like that you mentioned that. Teresa, what were you going to say? Yeah.
I was going to say, as far as people helping other people with that are going through things, and you see a family member going through things, they have support groups for you to go to. Because if you're constantly taking care of someone and helping them out with their illness or their sickness, it takes a toll on you. And you can't take care of nobody if you're not taking care of yourself. So you have to mentally take care of yourself and health-wise take care of yourself. Because if you can be, so caught up that you kind of check out mentally, and then you get lost in yourself. So you always have to have, if you don't want to go see someone specifically, you can go to their support groups. You can call numbers to talk to people. You can talk to your friends that'll actually talk to you and listen and let you vent and get your frustrations out, and also try to help you take your mind off things. Because when you're going through something like that with somebody, whether it's any type of illness, it takes a toll on you because you're worried about them. They're worried about their health. They're worried about how you feel. If you're worried about them and you're not taking care of yourself, it happens. And stress can kill you.
Right. Oh, yeah.
And it can kill a relationship.
And I need you to understand.
Yes. And it can kill a relationship.
Here he go. He want to go into something else. Look at him.
I'm just saying, like, that was part of, it was, a lot of issues, but that was part of the ending of my previous relationship, or my last relationship. That was part of it, because when you're going through something, it's that's why they say it can cause depression and stuff like that. Because when you're used, I was used to moving a certain way. You know what I mean? Like, I was used to being able to do certain things. You know what I mean? Absent-mindedly, like subconsciously, just can't. I didn't have to. It wasn't putting forth any effort, and then all of a sudden, one day you wake up and you can't do none of that no more. You know what I mean? It's like everything becomes, little trivial things become a trial and tribulation. You like, oh my God, like, I used to do this in my sleep, but now, like, this will almost kill me. That's something. That's an adjustment, not just physically. Individual has to make, is mentally. I always tell people like that ask me about it. I'd be like, it's an adjustment. I have to learn not just physically to adjust, mentally to adjust. I got to mentally adjust to it, because at first I couldn't. At first I didn't accept it. I was fighting it. And when you at that point, you start to take your issues and your anger and you internalize things on other people. When they necessarily don't deserve it. So that's a whole different ball game right there that people have to deal with, when dealing with somebody who's sick, because now, not only are they going through a physical change, it's a mental change too. And, at some point they might not want to accept it, and not accept it has them taking out their insecurities on you. I know I've done that. So I'm not about to sit here and act like I didn't do that. No, I know I've done that.
Ladies, I don't know if you have peeped this, but did you see this young man just take some time to acknowledge his wrong? Now, we've had that kind of show, but look at this young man here. He is apologizing to somebody. I see you playing. Yeah, that is a beautiful thing. I always said, no matter what, everything's a two-way street. Yeah.
You feel me? It's a reason for everything. There's always an action and reaction. A cause and effect. So at times you can't always. Sometimes you just gotta look in the mirror. At the end of the day.
That's right.
You feel me? Like, you just gotta look in the mirror and you gotta check yourself. You feel me? Because that, at the end of the day, that's the only person you have control over. The only thing that undeniably that you have control over is yourself, and how you control yourself. You feel me? We all talk about, the heart, the mind, and everything is controlled by the brain, your emotions, everything. You control all of that from the top. So at some point you just gotta look in the mirror. I can look in the mirror and be critical of myself. And I know I'm not perfect. You feel me? The only way I can improve and be the best I can be is self-check myself and listen to the checks and corrections of others. You feel me? That's just how I look at it. I've grown up a lot. I must say.
Since last week, you have definitely grown up since last week. Shout out to Clint. That's what's up.
The shade.
Because that's what we do on the after show, is throw shade. This brother is wrong this week. Okay. Clap it up. All right. Awesome show. Awesome show. Right. Well, listen, we are here each and every Thursday, 10 a.m. to 11:30 p.m. every single week. We'll see you guys next week on Thursday, March 17th. But before we get out of here, there's a ton of you who reached out to us and want to know how to get in touch with us, personally. Myself, Kenya, I can be reached on Twitter at Red, that is RED Raven 609 on Twitter. I can also be reached on Facebook at Kenya Funches. No dots. I'd love to give you my email. Kenya Funches on Facebook. And then we're going to find out how Jabril, Sharitha, and Clint, how you can reach them. Jabril, you want to tell everyone how they can get in touch with you?
Of course, get social. Find me, JRO609, JRO609, Facebook, Instagram, Twitter, Snapchat. I'm there. Google me, find it, hit me up. I'm here to talk to everybody. I'll respond. You hit me up, I'll respond back to you. Just find me somewhere.
Because they don't got no job.
And the shade continues.
Where you at? How can they get in contact with you, Sonny?
Y'all can reach me at IamSunny_D on Twitter and IG. You can also hit me up on my blog, undeservedlyme.wordpress.com. I will let you talk to me on Facebook, but the way my Facebook's set up, TLT Radio, find me on there. Facebook page.
But she works for the state, and she don't do anything either. Clint, how can we reach you?
You can reach me at on Twitter at E Trenton Grew Me. You can also reach me at akingstruth.com. That's my blog. You feel me? I'm on Instagram at Clint Black, Snapchat at King's Truth. You feel me? I'm also getting y'all everything.
Yeah, Snapchat.
Yeah, I got Snapchat.
Nice.
You are too old.
So
you are too old for Snapchat.
TFT Radio. TFTRadioshow.com. You know what I mean? You see the hate. They hate it. Snapchat. Now we about to dethrone everything. Snapchat is hilarious. I love Snapchat.
And I just want to point something out. Any of you guys that are listening out there, if you went to the absolute best middle school there is, Holland Day Middle School, Junior 3.
Amen.
Whenever Clinton said Trenton, when he said Trenton, I think about Mr. Livingston when he said Trenton. It is Trenton. And he was so serious about it. He was angry. He got mad. You probably got detention after that if you mispronounced it. But whenever he says it, when he says Trenton, he means Trenton. Trenton.
Junior 3 was like what Lean on Me was based on.
But y'all never beat us at We Didn't See, though. But y'all never beat us at We Didn't See, though. And that's all that matters, okay? Y'all was cute.
Or NDI, but we're not going to go there.
Thank you.
I was at NDI.
Hold on. Or NDI, but we're not going to go there.
Exactly. Y'all never beat us. Don't do it. Because I will call Anthony Robertson up right now. Okay? And we can shut this whole thing down, okay? Don't do it. I know y'all had Reggie. Y'all had my bestie Reggie, but that was all y'all had. That was it. Just Reggie. Nobody else. So let's not get cute.
Without Reggie, y'all wasn't, you know what I'm saying?
Reggie was all right. But I can say this because that's my bestie. Thank you so much.
We got cases right now.
Whatever. Seriously? You really going to compare Western and Eastern? We're going to do that right now? You know what? I was going to say something, but it was going to sound a little insensitive, so I ain't going to say it. Because y'all deep over there, okay? Thank you guys for listening into us, acting a fool. The Brew is very quiet because he lives in New Brunswick. He don't want to say anything because he lives in New Brunswick.
And half the females that went to Junior 3 got domestic cases on them. They all.
You terrible. You know, we're going to go ahead and end this call. We're going to end this call because now you about to get all kinds of lawsuits because this is just inflammatory, okay? This is just ridiculous.
What's this address again?
Seriously. You see this? This is slander is what it is. We thank you guys for tuning in, listening to us. We will be back next Thursday, March 17th at 10 p.m. same time. What we're going to talk about, we never know. But we do offer you guys the opportunity to tell us what it is you want to talk about. Again, if you guys are not registered to vote, please do so. In whatever state you're listening to, register to vote and make sure you get out there and vote. We'll see you guys next Thursday, March 17th, same time, same place. And you will have to hear about what we're talking about. Good night, everybody.
Good night, all. Good night.
Bye.
Geico presents sharing versus oversharing. Today, Bridget Griffin shared a video